This video will discuss details about liquid facelift.
Liquid facelift is the enhancement of the upper and the mid face by improving the lost volume of the temporal area and cheeks, which results in regaining the youthful contour of the upper and mid face. Patients who are good candidates for the procedure are women or men who want to correct the lack of fullness to the temporal area and the cheeks. Fillers are thick, jelly-like substances that are commercially available to reestablish lost volume in our body. Not all of them come from the same source. Please be aware. My favorite fillers are based on hyaluronic acid. The reason is simple. It is a normal component of our body. In addition, we have an enzyme called hyaluronidase in our body. This enzyme regulates and molds the hyaluronic acid. I like them because if there are any complications, the body will dissolve it in the long run. Here are some examples of fillers that are derived from hyaluronic acid. I would recommend to start with fillers that last 6 to 9 months. Once we determine that you like it, we can think about a more durable filler that can last for 2 years. There are other products shown on the right of the screen. Finally, I will reserve the long-lasting fillers for the cheeks. All these fillers can be found in the market. They are advertised as permanent, which is attractive due to the economical advantage of not having to inject them over and over. However, all of them have been reported to have long-term complications, deformities, and reactions deforming the tissues of the naive customers. Principle number 1 in medicine is not to harm. Some of the contraindications are listed here. Please make us aware of them during your consultation. There are also some relative contraindications because there are no studies on some patients. These include pregnancy, breastfeeding, younger patients than 18 years old, hypertrophic scarring, and pigmentation disorders. Now let's talk about some of the complications. The purpose of this segment is not to scare you but to inform you. As listed here, redness, bruising, pain, firmness, swelling, itching, and discoloration, most of them are temporarily. Other complications include bruising. I have not had bruises this bad. This is a picture from the internet. However, if you are in blood thinners or aspirin-like products, it is most likely to occur. This will be a temporary issue. However, it is difficult to justify to your social environment. Make sure that you don't have important social events 2 weeks around your filler injection. Now let's talk about some patient examples. This patient was complaining of lack of fullness to the mid-face. Notice that the right picture has more roundness and fullness to the cheeks. This patient was complaining of lack of fullness to the mid-face. Notice that the right picture has more roundness and fullness to the cheeks. This patient was complaining of lack of fullness to the mid-face. Notice that the right picture has more roundness and fullness to the cheeks. This patient was complaining of lack of fullness to the mid-face. Notice that the right picture has more roundness and fullness to the cheeks.
Thank you for considering us for your procedure and welcome to our practice. Please contact us by phone, email, or through our website.